Hi, welcome to my channel and please don't forget to like, comment and subscribe. Today I bring a topic about person insurance coverage is now much more complicated in the wake of the Supreme Court ruling. A person benefits will depend even more on where a woman lives and who provides her insurance. Even before the constitutional right to an abortion was struck down last month, health insurance coverage for it was spotty. Abortion benefits largely depended on where a woman lived or whom she worked for. Those factors are become even more crucial now that the Supreme Court has left it to the states to regulate abortion. The existing patchwork of coverage is likely to become more restrictive, and the gulf will widen between states that had already banned abortion-related benefits and those that mandate coverage. Dozens of large employers are attempting to fill the gaps by paying expenses for workers who need to cross state lines for a legal abortion, though there are still questions about how much risk companies are taking and how far an anti-abortion state or an aggressive prosecutor could go to stop them. For women without that extra support or coverage, the new logistical challenges and the added costs may be impossible to coverage. People with financial resources will find ways to get the treatment they want or need, said Susan M. Nash, a benefits lawyer and partner at the Winston and Strawn with expertise in healthcare. But the people who can't travel or have limited means to access treatment outside of the health plan will be adversely impacted here. Here's a look at how the decision Dobbs v. Jackson may affect insurance coverage across the country. How much does an abortion cost? The median cost to a patient for a medicine abortion, which involves two drugs and generally taken up to 10 to 12 weeks of pregnancy, was $560 in 2020, according to a recent study at the University of Carolina, San Francisco's Advancing New Standards in Reproductive Health program. A procedural abortion was $575 during the first trimester and $895 during the second trimester. That doesn't include travel costs and also other expenses, such as child care and time off from work, which will be increasingly necessary for women in growing number of states, and also costs vary substantially by region. Most patients pay out of pocket, research has found, in large part because their insurance does not cover the procedure. Even before the Dobbs decision, 11 states restricted that type of abortion coverage. Private health insurance plans could cover, and 26 states barred at plans in their state's health insurance exchange from covering abortion. And researchers found that the people who can't travel or have limited means to access treatment outside of the health insurance or health plan will be adversely impacted here, said Susan M. Nash, a benefits lawyer. And then the next is Callahan O'Hare for the New York Times states that will Medicaid cover the abortion? Just like before the ruling, that largely depends on where you live. So I think it is very crucial help in America about abortion. But in Indonesia, a person itself is like a form of sin, and I think it was so not necessary, because a person is sin things, and um, it same with kill a human or kill a child. And thank you for watching, and don't forget to like, comment, and subscribe.